Hello, my name is Donna and I'm a holistic veterinarian in Bellingham, Washington. I've been in practice for 26 years, and I am the author of 3 books on holistic veterinary medicine. So as you can see, I'm really dedicated to veterinarian medicine and animals, and I just wanted to share with you something you may not hear when you go to your regular vet if you have a dog that's been diagnosed with a pretty dire situation. And so that's why I wanted to bring this to your attention. So I wrote 10 steps to prevent, and there are actually 10 steps to treat cancer, which is on my blog, which is Northwest Holistic Pet Care. So the first step is a diet, and we usually like a raw-fed diet or a homemade diet. And we want to try to minimize factory farm meats. And you can find out more about that on my website. That's number 1. Number 2 is trace mineral supplementation. So that is like selenium and zinc are the most important ones, and they're often deficient in our pet foods. And you can read more about that on my website. I try to encourage clients to feed their dogs just single ingredient treats, and that's number 3. So no artificial ingredients, and no molasses, and no vegetable glycerin, and no chicory root. Ideally, these are sugars that the body can then basically metabolize into sugars. Number 4 is vitamin A supplementation. So that's, usually I use cod liver oil, but you could also use beta carotene in some cases. And I have a dose on my website of 1,000 IUs per 80 pounds of body weight. The 5th one is immune modulating mushrooms. Reishi, maitake, shiitake, and turkey tail mushroom are all used in my practice a lot to treat cancer. Number 6 is immune strengthening herbs. These are herbs that your holistic vet, hopefully, can prescribe to you to help your dog balance his energetics. So if he's got a weak kidney, they want to strengthen the kidney. If he's got a weak liver, you want to strengthen the liver. In this way, you can keep the body balanced so the dog can fight his own cancer, or cat. We want to keep vaccinations to a minimum. This is number 7. And when you do get vaccinated, we want to try and use mercury-free options, and we want to use Vivo Zeal Clear or Thuya, or a combination of some type of detoxification assistance. Number 8 is generally using holistic medicine for your pet's care instead of a lot of pharmaceutical medicine. So this usually means that you have a holistic vet that you can turn to if there's any problems with your pet's health. Number 9 is trying to keep its cleaning and lawn care products clean, which means, or non-existent, which means trying not to use chemicals around the house. And number 10 is exercise and freedom. So what this means is that you want your pet to feel empowered in his life. And I have a lot on this in my 2nd book, which is called The Proof is in the Poodle. My most recent book, Zen and the Art of Caring for Pets, talks a lot about cancer therapy too. And right now I have a video for you of me treating a dog named Halle, who was given a very dire prognosis from her thyroid carcinoma. So in this video I talk about how, and I show you how I use chiropractic and acupuncture and herbs to help this dog's pain. And I hope it is of benefit to you, and maybe you could subscribe to this YouTube channel. That really helps support our work. Please, that would be awesome. Share it, kind of get the word out there. We sort of need a revolution in veterinary medicine, and we're not going to get it unless we have people like you who are engaged. Thanks so much. Bye. Gain weight?
Oh, she's gained weight.
Oh yeah, well that's good.
I cut back on her food,
Okay.
but all the potions and stuff she's getting must have calories in them.
Well, you know, we just sometimes need a little extra food to make it go down.
Yeah. Uh-huh.
Okay.
Well, what do you think, huh?
Yeah, I thought we could just kind of tell people about her because it's just like people don't really know there's options with cancer therapy, you know what I mean?
Yeah, and she's definitely, I am absolutely dumbfounded at how well she's doing. And according to the oncologist, she should be, I should be looking at putting her down.
Yeah, and look at her, she's just doing great. Yeah, good girl, look at you, huh?
Yeah,
Well,
my goodness.
So she was diagnosed with the thyroid carcinoma. Was that, let's see, can you give me the timeline on that?
I found it the end of August, so the first part of September.
Okay.
We spent weeks trying to diagnose. It was found on an x-ray because she collapsed the first week in September. She could not get up.
Right.
She couldn't eat. She was in agony.
Oh no, I guess I forgot it was
And
that
yeah,
bad.
when this dog says she won't eat, death is imminent. And she was skin and bones. And I took her in, they x-rayed her, I thought she'd hurt her back. And it was worse. They found because of the holiday and stuff, it just took forever. But they found the tumor. I went to the oncologist at Bayside, over at the emergency clinic, and they gave the diagnosis, the treatment, and it wasn't something I wished.
It was mostly chemotherapy, right?
It was
I mean, were they gonna,
surgery, but
were
they
gonna
knew
do
they
surgery.
couldn't get all of it. It had
Okay.
metastasized,
Mhm.
so having survived stage 4 cancer myself, I said, I'm not doing that to a dog,
Yeah,
especially one I like.
yeah.
So I contacted you, waited till I could get in to see you, and I've got a little botany background, so I started researching and putting
Yeah.
on stuff I thought would help. I
Well,
couldn't hurt her.
Well, and the herbs that you put her on, I think already helped before you even
And
came.
yeah, there was
It
an
was amazing,
improvement,
yeah.
but I was still putting an awful lot of meloxicam in her.
Okay, yeah, and that's where we try to minimize the pharmaceutical part of it, and then that's what brings us today, because you
Yeah.
said because she not only has the history of the thyroid carcinoma, but she also has back.
She's got 3 shot discs from
Okay.
a very athletic lifestyle.
Yeah, yeah.
She doesn't do anything partway.
Good girl, Halle.
It's pedal to the metal.
Pedal to the metal.
So,
Okay.
she has 1 gear high, and she's got one here, and one here as far as
Yes.
discs go.
Yep.
So pick your poison.
Yeah. Well, it's so nice with acupuncture and chiropractic because we can kind of help all those problems, especially when you add the herbs on there. And so I thought today we just do some acupuncture and chiropractic and show how we do immune system support using acupuncture and how it's a viable option for cancer therapy.
And it's really helped because it's taken the stress out of her life,
Yeah.
which I'm hard put to say what's helping more, the herbs or the acupuncture and chiropractic.
Yeah.
Because when you can see muscles rippling and stuff, you found something that needed to straighten up.
Yeah, right. There was a malalignment within the
Yeah.
back, and you have to a lot of people say you can't do chiropractic with an active disc or with a disc herniation, but I always say I learned some soft techniques for chiropractic, so it's not just this
Yeah.
I think it's good for people to see the gentle chiropractic
Yeah,
and how you
Because it's made a huge difference.
and how you can really help.
And
these
for Tuna,
dogs.
she will stand forever.
Aw.
Yeah.
Well, it's, you have a history of dog training, so you know about how to help her, guide her along to knowing everything's going to help her too. I think that helps. She knows you're on her side.
She trusts me.
Mhm.
And
So,
the funny little tag that she's had there on her eye for many years
mhm.
has totally changed its appearance.
Oh,
I snipped it out so you could get a good look at it.
oh.
It's really changed.
Do you think
To
it's
the
gotten
good.
smaller?
It's
Yeah,
smaller.
well, I see. This is you're talking about this tag.
that
It's
little
not,
guy right there.
it's a dermal tag, but it's
Yeah.
not
It's
on the eye.
Yeah, it's not on the eye, but it
Mhm.
has changed its shape. It's smoother and it's smaller.
Yeah, what if that shrinks as a side benefit to the herbs and stuff? Isn't that funny?
Yeah, so, well, beauty counts.
Well, it does, right, Halle?
Yeah.
Okay, so right now I'm just checking
Yeah.
for movement, making sure movement's equal, right and left, right and left, right and left. I mean, her back's completely gotten better since.
Oh, it was bad last time we came in.
Yeah, and but she did have some pain between now and then. You said she was
Yeah,
doing some rough
we
housing.
had a couple days, but considering she's playing with a freight train.
Oh, is this the other dog? Is
Yeah, Joy is sometimes a little too rough, instantly regrets it, but.
And is that your other dog, or is
Yeah,
that
that's my other dog.
Oh, okay. Okay, the only abnormality I'm finding today is that her sacrum has shifted.
Yeah.
Instead of being like that, it's like that.
Yeah, that's kind of where I thought.
So we're gonna.
Our caboose is not working as well as it should.
Our caboose.
Yeah, you're such a clever
Okay, so we're gonna do a little bit of a.
Yeah.
So there's two ways to release that. One is just to move it over like that, and the other way is there's a ligament right here, and sometimes I'll just strum that ligament, and that will release it on that side. Let's see if that worked. It's kind of, the sacrum is a funny area. A lot of people think, oh, you can't adjust it, but kind of more Western people, but.
My chiropractor used to be able to get mine. If they could do mine, they can do anything.
Aww. Do you still do some holistic support for your health too,
Yeah.
or do you?
Yeah.
Because I know you went through the cancer therapy that you had talked about before, and then it's ironic in a way, or kind of an interesting, cool thing, is that you got her right after you.
She was my reward for
Yeah.
surviving. I kept telling myself, if I can get through this, I get a puppy.
Oh,
And
I love that.
I had the breeder all lined up and passed on 2 litters because I wanted to be sure I was going to survive.
Oh,
And
it's
then
just such a neat.
she bred this litter because she knew I wanted one, and I wanted it out of a certain female she
Certain
had.
ones, yeah,
Yeah.
You knew what you wanted.
I knew what I wanted, and I wanted a working dog, and man, did I get it.
She was like, here you go. Okay, so these are the immune points we're doing. We're doing large intestine 11. That's an excellent way to strengthen our white blood cells, and we're also doing a spleen point called spleen 6 in the inside of the back legs. It's kind of hard to see, but it's also one of our master immune points. And then I usually do a little bladder 40 to open up the spine on each side. And I think the acupuncture actually holds the chiropractic better and makes it more effective. So it's a kind of shame that more human doctors don't combine them. I guess it would take a lot of years of training, but still. So in terms of, I think I'm just going to move that back shoe point back to where, a little bit closer to the sacrum there.
My goodness, it's just endless on this tuna.
Well, and I mean, when you first came, I felt like I could, feel it, and I
can't, I'm having trouble finding it,
It's-
so something is changing.
I'm like, okay, I don't know if we,
I think it's there, and I put her in some really strange positions trying to find it.
Oh,
And,
that's funny.
but my fingers aren't because I have a lot of neuropathy from the chemo, but,
you have that.
oh boy.
Well, and I guess that's something,
It's
people
common.
don't think about that. Yeah, it's just like I wonder if dogs get neuropathy from chemo.
That was
I mean,
gonna be
they-
my question to you was,
I don't
did I
know.
can dogs get neuropathy? I would assume they can.
I mean, they can get neuropathies, but we usually only see it as far as a motor control issue. We don't know about a sensory issue. Do you know what I'm saying?
Yeah.
I don't think, so bladder 18 there, and we got a bladder 25 here, and bladder 40
Yeah,
here.
you're starting to look like a porcupine.
That's good. Let's see, I think we're gonna do a little bit of triple heater just to open up that part of it. I usually try to do it at least on the right, that's where the tumor, where I felt it originally. Triple heater 3. Okay, so that's kind of our little acupuncture for Halle. And then I'm gonna make up a tincture today for her back, just
Yeah,
so you
okay.
can use it, so you don't have to use pharmaceuticals for back pain. I mean, you can, but it's sort of nice to
Well,
try
if-
something that, you
I'll
know.
try anything once. I used to use that tea.
Cordialis tea?
No, it's for humans. Arnica, it's an arnica combination. It's
Okay.
a holistic thing.
Arnica's not usually taken internally,
And-
but
Yeah,
maybe it was a
was
homeopathic?
yeah, it was a homeopathic,
Oh,
and it helped for a while.
just
but-
reduce the swelling.
Yeah, it kind of helped more than anything with inflammation.
Yeah,
And it helped for a while, and then it ceased to work.
okay, yeah. Well, I usually combine 5 herbs in my pain tincture, and it's good for inflammation too. So I use cramp bark, and I know you're a botanist, so we can
Yeah.
kind of talk about that. So it's a viburnum opulus.
Okay.
It's the inner bark, and what it does, it kind of acts like a muscle relaxant. It is a muscle relaxant.
Yeah, that
Kind of
would
like
help.
the old Robaxin, you know,
Yeah.
that they used to use when their backs would
Yeah.
spasm. Anyway, I use that. I use a herb called wild lettuce, which is just it's a weed. It's a lechuga weed, and there's this white latex in it that's almost opioid-ish. I mean, you know, it's not
Yeah.
going to be like addictive or anything, but it's excellent for pain control, and it also slightly sedates. That's the only thing about it. You have to find the right. It's not going to sedate like a drug, but
Slow her down a little bit, which might not be a bad idea.
well, yeah, it's dose dependent, so you might go for like 5 drops rather than 10, you know, and just kind of play with that a little bit. I put Cordialis in it too, which is also a little bit opioid-ish in terms of how we got on the whole morphine path. I mean, that and the endogenous opioids that we have. So it kind of taps into that system, which is our own pain healing system. That's the same system that acupuncture works on. And let me see, how many did I do? 3. Okay, we also put a little dogwood in there that's the anti-inflammatory part. And gosh, I think I might be forgetting one, but I think, and we don't have to use this one because we've got the wild lettuce, but we can use a little California poppy in there. Depends on how much pain we're talking about. That's my really good one for pain.
Yeah, she's
not in pain now.
no, when I really see it is at night. And you just
Okay.
hear these deep moan
Okay.
every now and then. And she's,
So maybe we put her on a low dose, and we do put the poppy in there, and we put her on a
Yeah.
low dose all the time. But then when she's more active, you can always give her like a half dropper
yeah,
full.
give her
Yeah.
less.
And you can
Because
give her
she's so good at hiding pain.
Yeah, a lot
Yeah.
of the working breeds aren't they?
Yeah, and these guys they were a poor man's dog for centuries, and, you know, if you were weak, you didn't live. Because they couldn't afford to keep them going.
So these guys are standard schnauzers
Yeah.
versus the minis or
Yeah,
the
this is what the
giants
other 2 breeds come from.
So they're more, this is an older breed. Is
Yeah,
that right?
much older. It might go back about 1,000 years. They're seeing
Ah.